the BC government announced plans to fund one round of IVF for people trying to have a baby. But those relying on that funding will have to wait a bit longer now. The program was set to launch in April, but has now been delayed until July. For more on this, we're joined by Pacific Centre for Reproductive Medicine, Dr. Ken Seethram, the medical director there. Dr. Seethram, we appreciate your time. This may seem like a small delay over a course of a year, 3 months, but it will make a difference for those who are relying on the funding for in vitro fertilization. Why is the program being delayed?
I'm not fully privy to the knowledge about why the delays occurred, but I do know that there are lots of bits and pieces around the funding program that had to be dealt with. For instance, the government wanted a centralized application portal, which is unique in the country, to monitor the utilization of this program. And in order to do that, they needed a secure portal to have the application process. I think that was one of the factors of many that went on. Mm-hmm.
We also understand you had a role, some advisory role to the government in this way. Are you able to explain what you either recommended or your role there?
Yeah, there were a few physician advisors on the program. Our role really is to be content experts on what fertility is, the treatments for fertility, including IVF and other related items like frozen embryo transfer, genetic testing, and the utilization of medications.
And so what would you say, I guess, or for people now who are facing a time crunch as a result of this delay, because many will have been planning for this?
Yeah, it's very difficult on people when there are delays, for sure. Infertility is a disease, and one thing that this program really highlights is that the public is now paying attention to the affliction of infertility. It does affect 1 in 6 people in their lives, and it's a very important disease to pay attention to. The time lag, it can be frustrating, but the 3-month difference also allows us time to make sure patients are suitably counseled and prepared and ready for the journey of IVF if that's what they need to start or expand a family.
Why do you think public funding is so important for a program like this, particularly in BC?
BC is a very unique environment. We have the lowest birth rate in the country. We have the highest first age of first child in the country. And we really need to address some of the economic and social factors that stop people from starting or expanding their families. It's very expensive to live in this part of the country, and so people do feel the need to have their lives a little more economically fit to have a child, which is extremely valid. But that also delays the first age of childbearing, and that brings with it other complications such as infertility and pregnancy-related complications.
What advice would you have for anyone affected by this delay?
I think right now it's important to make sure that people that are seeking to conceive get the appropriate care, consultation with fertility specialists. Sometimes the investigation phase can take a few months anyways, and allowing that time to both do the right diagnostics, ensure that IVF is the right treatment because there are so many different fertility treatments for patients, and also to get their bodies ready for the fertility journey and pregnancy.
Dr. Ken Seethram, the medical director at Pacific Centre for Reproductive Medicine, we appreciate your time and your expertise. Thanks for joining us.
Thank you, Dan.